thank you so much for coming back to the Relentless podcast. If this is your first time joining us, this podcast was started to help people on their journey to physical, mental, and emotional well-being. I am a body worker of over a decade experience in manual therapy, and my goal is to bring practitioners to my listeners that have experience and expertise outside of the physical palpation world to help them find out what is wrong. So my guest today is a practitioner of medicine. That is something I encourage people to venture into and learn more about, especially when they're not getting the answers they're looking for in other methods of healthcare. So Michael, thank you so much for joining me today.
Oh, thanks. Happy to be here.
And you are located in the great state of
Illinois.
And
Outside of Chicago.
I'm coming from Charlotte, North Carolina, and if you wonder how we met, it is through a network of practitioners, and we have a lot of the same certifications, and we have a private group that we all kind of are cohorts in of sharing ideas and thoughts and learning from each other. And when I found out his specialty, I knew I wanted him on the podcast because it's a realm that I'm not too familiar with. But like I said, I push people in that direction to try to find answers. So what exactly is your licensure, certification, qualifications? Let everybody know.
Sure. So in Illinois, I'm a licensed acupuncturist. And so basically I'm a practitioner of Chinese medicine.
Wonderful. And that scares a lot of people. They're already like, oh, what does that mean? What's that hokey stuff? Do you get that a lot?
Sometimes I do. But it's a very, physical, practical medicine. So, it's something that I think once people kind of experience it or once they get over their fears, they find a lot of benefit from. So it's very gratifying.
That's exactly what I want this podcast to do, is to educate people on how this can help, because I know with the clients I have, they're telling me what they're doing isn't working, but they're just too afraid or uneducated or don't know anyone else that has tried anything different. So that's what I hope to do, is remove some of those barriers and questions people have about trying a different modality. So before we get into like the nuts and bolts of it all, I want to know about your story, because I know your journey into this realm of medicine started with a literal journey for you in China. So tell us about that.
Sure. So I was actually in graduate school at the time, and not super happy with what was going on with what I was studying, and really thinking this is not for me, studying physics. And so I was just looking for opportunities I thought it'd be fun to go overseas. My goal, initially was I want to learn a new language. And I thought that learning a language different from English, like really different, would help me think differently. I was like, it'll like expand my mind in some interesting way, right? Mm-hmm. So I found an opportunity to go to China, and I taught English for a while, kind of they called it a suburban countryside setting. So it was it's fairly rural. I had to walk about 10 to 15 minutes to get, to the first bus, that kind of thing, to take me to a small town to get me into the city. So, but it was a really, really interesting experience. Definitely learned a lot from that. So, so while I was there, got exposed to Chinese medicine. I met someone who was in school practicing, or, learning to practice, and had my first experiences with acupuncture. And I think most significantly at that time with herbal medicine, helped me quite a bit. So I had a pretty bad sickness right before Chinese New Year, which is a long, about 3 to 4 week time, where they have off. It's like their, Christmas, New Year break. Mm-hmm. And, I got really sick, just, was worried I might not be able to travel. We had this big trip planned. And, the school clinic, was giving me some antibiotics, through IV and some other treatments, and wasn't helping. So, talked to somebody, they gave me some herbs. After like 2 doses, a morning and an afternoon dose, and then woke up the next morning about 70% better. And I was quite impressed. And a couple more days of that was, really on the road to feeling better. So I went on my travels and, saved me for sure. So that was great.
So that started your mind thinking there's something else out
Yeah.
there.
Like, hey, this was really cool. I mean, just the rapidity. I mean, just in one day to see that much improvement, really impressed me. And so, yeah, I was definitely like, okay, this is cool.
So going back to when you were in school before that, what was it, do you remember exactly, that just wasn't settling with you about Western medicine paradigm?
Well,
Is there anything
uh,
specific?
I mean, it wasn't so much the Western medicine paradigm. It was, so I was studying physics. So it was just um, something about it just wasn't right. I mean, it was a little bit too theoretical, I think, and a little bit too, like I need something very practical. I am, very much kind of a hands-on practitioner. I have been, and I like being involved with people. So I didn't necessarily want to either like sit in a lab or, sit at my desk and stare at equations, that kind of thing. So, so something, a little bit more of a helping profession, was something that I was looking
You
for.
need the give and take.
Yeah, yeah,
Yeah,
sure.
absolutely. Well, I'm a hands-on therapist, so I totally get that. I kind of wouldn't have a job if I didn't have that exchange.
Right,
So,
exactly.
so after that experience of getting treatment, how long was it then before you started looking into Chinese medicine?
So before I actually studied it, it was about 5 years actually. So I was in China. When I came back, I was married and I had a kid, and so it was, yeah, she was almost 5. It was 2005 when I started school in the fall for Chinese medicine. So I had been studying Tai Chi, Chinese martial arts, a little bit of like the Taoist philosophy, that kind of thing. So and in the martial arts traditions, there's kind of an idea that you should be able to heal as well as damage.
Yeah.
It's so and it just seemed to be right.
Mhm.
Yeah, it seemed to be right at the time. So.
And how did you seek out the school that you went to for your education? How did you find them?
Well, actually, we moved to Chicago specifically so that my wife at the time could go to school there. So this is where she graduated,
Okay.
and so I just went in. It was actually funny. I went in for the interview at the president's office, and I showed up, and he was like, "Oh, it's you. Why don't you just call me? You didn't have to come in here." So because he'd known me from picking up my ex-wife, and I had my kid on my shoulder, and full clinic and everything. So everybody knew me there already. So it was a pretty easy decision, to go there.
So one of the first things that when I'm trying to help people think outside of the route that they're on and consider something else, one of the first questions is, well, how do they know what they're doing, and what training do they have, and did they have a residency? So because I know I went onto the school that you got your degree from and looked at some of the information, and it was all amazing. But tell them a little bit about what your education was like, what your training was like, and what that process looks like.
Sure. So at that time, we got a Master of Science in Oriental Medicine. So it was a 4 academic year program. Um, and what I really liked about this school was that they put their students in the clinic right away. So initially, like the first semester is just observation, but as soon as we can start learning, maybe you've heard of cupping and, gua sha, or some people, a similar thing like Graston technique is, and as soon as we learn those accessory techniques, then, we start to do that under the guidance of some of the supervisors and the more experienced students. So we're in the clinic right away, and they had also at that time a free clinic. So it was in a little bit of a poorer area. So there was a lot of people using their clinic as their primary medical care.
Mm-hmm.
So, we got to see a lot of different cases, treat a lot of different people. So I mean, if you were willing to work, you could see as many people as you wanted, really. So it was really cool.
I bet that was an amazing and humbling and like lit a fire under you experience too.
Oh, for sure. Yeah, I mean, it has its frustrations, obviously, but I mean, it was definitely so much opportunity to learn. So it was definitely, yeah, it was a great place.
And through the education that you got, I know I was reading different things. It's not even in that curriculum, they weren't saying our way is the only way. And the only thing we're going to talk about is this type of medicine. It sounded like they were teaching you how to work with other practitioners and incorporate what you do with what someone else may be having done as well, and to start that conversation.
Yeah, for sure. It was really important to be able to, talk in a way, that your patients could understand. We did take some basic pharmacology. We took, it's like everybody, anatomy and physiology. Sort of from the Western perspective, but then also, from the Chinese medicine perspective too. So, it's important to be able to, to translate the worlds, so to speak.
Mm-hmm. And one of the things that I try to educate my clients on, because a lot of times, and again, there's like, good lawyers, bad lawyers, good massage therapists, bad massage therapists. So you have practitioners that are holistic and alternative care is the only way to go. Western medicine is bad. And I try to tell them, it's kind of like, a religious fanatic. There are
Mm-hmm.
those out there, but myself, colleagues that I work with are never one or the other. It's
Mm-hmm.
not either or, it's which one when and for what reason, and is it working?
Mm-hmm.
So myself, I know you, the other practitioners that we work together with, don't think that Western medicine is bad. It just has limitations.
Yep.
So maybe in how you view those two different paradigms, explain to people what your, philosophy that you think Western medicine brings to the table versus the philosophy and practice that Chinese medicine brings to the table.
Sure. So I think they're coming from really very different worldviews at the start. So the modern Western scientific worldview, is very reductionist. So it's like, let's figure this thing out, look at its most basic constituent parts, what they do, and how that's contributing to how the thing functions. It's a very powerful way to look at the world. And in Chinese medicine, it's a bit more of a systems way of thinking, and integrative. So, what we look at is, I mean, obviously, they look at the different parts and the organs and everything and how that works. And they understood circulation actually before anybody else in the world did. But they also look at the way things are interrelated. And, I think the thing that I often explain to clients is sometimes, like you take a study that, tries to look at, some blood markers, say, and say, oh, when this is high, there's greater incidence of, some disease. So therefore, all we have to do is just make sure this marker is lower and we'll be able to reduce the incidence of this disease. But it's really difficult in a study like that to understand that if you change this one thing, it's also related to like 30 other things, that suddenly change too once that's changed. So what I find is really powerful is kind of understanding and trying to think about how everything works together. So we think about, like the respiratory system and the digestive system, the urogenital system, the nervous system, and everything is interrelated, and you can't just kind of tear it apart and pick it apart. You can do that, but then you got to put it back together and realize how it works. So in my mind, I mean, especially coming from the Chinese medicine and Chinese martial art background, thinking about it's a yin yang idea, right? So these two ways of thinking, they're interdependent. You can't just throw one out the window. And either one can be powerful, but when you integrate them and understand their strengths and weaknesses, then you have the most powerful, system that way, I think. So that's the way I look at it.
I think that's a great way to depict the need for both of them. Again, it's not one or the other, it's which one, when, and why. And I think, to me, it kind of is a good comparison to, I grew up in a Christian home, and I'm in the South, so I'm surrounded by a lot of Christian people. I'm a Christian myself. But again, there's a paradigm of thought process on that type of thinking that it can be very harmful or can be great. Right in the middle, as with almost all things, is where you want to fall. But
Yeah.
growing up, I remember even just saying the word yoga was bad, because those people are, mysticism and religion, and so I just, as a child, I thought yoga was bad. A bad person would do that, and it was bad for you if you did it, not understanding what it really was or could be. And people use it for different things. But as I got into movement and movement therapy, and I had clients that couldn't do the physical therapy they were being told to do, they couldn't do the stretching they were told to do, it was too hard for them. I'm like, I have to find a way for my people to move gently that doesn't hurt them. I was like, well, maybe yoga could do that for them. And then I have a very good friend and colleague here in Charlotte. Her nickname is the Stretch Lady, Allie Faber. We did a podcast together, and she talked about yoga doesn't have to be religious. It may have started a certain way or used a certain way by some people, but it's gentle movement that doesn't hurt people. And so as a massage therapist, when I first started looking for something to help my clients, I then gravitated towards yoga that would help people, the good, traditional, because there's all kinds of yoga too.
Mm-hmm.
I even heard there was a martial arts yoga, which I was like, yeah, they're in here in Charlotte. I'm like, how does that work? Isn't that the opposite sides of the spectrum? But, when comparing Chinese medicine, Western medicine, is it bad? Is it a religion? I think that's a good comparison, yoga and movement therapy. It's what you're using it for. What do you think about that?
Yeah, that's really interesting because I've heard I think I read a while back some different tracts about how beware of acupuncture, Chinese medicine. It's based on these different things, and that actually it brings up a really interesting point that as we had talked a little bit about demystifying Chinese medicine, right? So a lot of the misunderstanding, my understanding of the misunderstanding, comes from a mistranslation. So all these texts are in Chinese, and as people were going over to China and looking at what they're doing, learning about it, reading the text, bringing them back, translating it, there was a French guy, Georges Soulier de Morin, I think is his name, if I maybe pronounced it right, or close to it, in the early 20th century, and he translated the idea of qi as energy, and translated a word that referred to vessels as meridians. So then you ended up with this idea whether there's some invisible force of energy that's traveling through these invisible meridians, and a lot of the current understanding is different than that. And so even some of the people who studied Chinese and sinologists recognize that he didn't translate that correctly. So qi is more accurately referred to as vital air, or gas, something like that. So same word that's used like when you put gas in your car, the word qi is part of the word for that. And, when you breathe in air, that's qi. The air around us has the word qi in it. So, when you think they're saying, oh, qi is a vital force. Well, sure. That's a vital force.
Try living without it.
Yeah, it sure is. So it is, it's not something, mystical. It may have come from a culture where they didn't have, quite the same reductionist thinking that we do, right? The same technological things that we do. But they were really smart, and they looked at the world and tried to understand how it worked. They looked at the body and tried to understand how it worked. A lot of the ways that they understood the body is they thought about the internal and the external environment, creating a balance between those. And they used analogies with the external environment, to sort of illustrate how things were going awry, and sort of the pathophysiology of disease in humans too. So
that makes all of this it's helping me too, because like I said, I haven't experienced it in my own health journey. Thankfully, I've come across practitioners that have helped me on my journey. I haven't experienced Chinese medicine yet, but it's wonderful that we can start to, even now with science, we're proving these things. So I know the word energy scares a lot of people, and it was odd to me too at the beginning of my career. But now we can show scientifically how far out from our bodies our energetic field goes, and we know what it feels like when that person walks into the room, and we get that uneasy feeling inside. It's energy, and I love that there's so many correlations. If people would just stop and take the time to match things up and make the correlations, like I love that you're explaining how even in this paradigm there were mistakes in the beginning, there were misunderstandings in the beginning. And I love how when medicine messes up, they call it practicing medicine, and they tend to get away with whatever. Well, the bloodletting was a thing for a long time. That was a treatment for a long time. And biblically speaking, we were told long time ago, the power of life is in the blood. Hey, maybe don't let all that out when you're sick. So there's parallels that run along different philosophies, different originating groups of people. That is the truth. So that's like when people ask me, should I try this therapy or that therapy? I tell people there's going to be an underlying piece of truth in almost every type of therapy, that if it's good, it is going to help you. So in my mind, it's almost like there are different people, different, experiences in life on different parts of the planet that have seen different things. And some people just have a better way of listening to the body. And that's what I think Chinese medicine does.
Yeah, nice. Yeah, that's a great way to think about it. So because we didn't have, or they didn't have, different instruments, they couldn't, say, oh, go to this lab and get a blood test. They had to observe what they could on the body, without, cutting it open or taking anything out. So, a lot of our diagnostic technique, is based on observation of the body. And, this is a lot of things like, simple things like, color of the face and, what does things look like and smell, but also like really careful observation of the pulse, careful observation of the tongue, which, now we know, think, well, what does looking at the tongue tell us? Well, maybe it tells us a lot about the gut microbiome, which is a hot topic these days.
Yeah.
So, they worked out, how different appearances of the tongue and the coating, affected certain patterns of disease. And now we're kind of able to translate that into, to things that we know in science and the gut microbiome. So that's pretty exciting. It's really interesting.
I think that's an important point to point out again, is one system has a certain way that it maneuvers. And the other paradigm of alternative or holistic care is very observational, very much, well, if this is happening, what is also happening in these other places? And then we start seeing these things over time and the correlations and the similarities. And I tell everybody when I'm working with the body or a shoulder, a hip or whatever, we like baking a cake. You can add in different coloring and a little bit of a different flavor, but it's pretty much the same recipe every time. And the same with dysfunction or disease. There's different expressions of said disease or dysfunction, but how the body got there and the symptoms that it shows over time as a practitioner, we start to see some real correlations. So let's dive into like what treatment looks like, looking at the body from that paradigm. You've already talked about the tongue, and I know eyes are another thing that people look at and observe. So when you start working with someone, what does your intake process look like? What are the questions that you're asking?
So the first thing I ask is just, how can I help? So the idea, I want to see what it is that's, not right for them and what they want to see change. And then, we start to ask questions about, the different functions of the body. So, depending on what they tell me, I mean, if it's a musculoskeletal issue, like a lot of people, we start to do some range of motions, what movements hurt, what makes it feel better, what makes it feel worse, all these kinds of things. And then we interpret the answers, based on our paradigm, of what's going on. And, I ask a lot about digestion. We start to ask about sweating. So a big thing is like the fluid physiology. So the human body is mostly, I say, it's mostly water, right? Well, there's all this fluid physiology, different types of fluids, and how are they functioning? And if you balance that, you actually can create a lot of healing that way too. So sweating, absence of sweating, do I feel thirsty all the time? We also ask people about, how's their experience going to the bathroom? Do they urinate too much, too little? Excessive smells. This all reveals again about kind of the biome of the body. So, there's the gut microbiome, the urinogenital biome, and so when things are out of whack there, then we can use acupuncture, herbs, different things to make adjustments. So
what is it then with acupuncture that, if I come in with a hip issue, I think, but then I tell you I'm constipated, and I just start naming off these things that I don't think are correlated, but then you start, when you start, because I know what you're doing when you're asking these questions, you're finding that roadmap that got the patient to where they are expressing this now symptom, which is what other practitioners don't do. They just see the symptom and attack the symptom. But when you start asking me these questions, how then does acupuncture come in to help the body find homeostasis, which is what I know you're trying to do, to help the immune system, all the other systems normalize so that it can heal itself?
Yeah. So well, let's go back to a little bit what we talked about earlier, is thinking of the way that Chinese medicine thinks is more of a systems basis, right? And so we're looking also holistically. So we have to know information about the whole system to understand, the parts. So the hip pain, I mean, it could just be, they fell, it could be an orthopedic issue, a musculoskeletal. So you have to kind of, as part of the intake, differentiate, what's going on. So when we ask all those questions, we want to know, let's try to say this. So sometimes people come in and they tell me they have a name, some disease, some diagnosis that they got, from another practitioner. And I'll say, okay, that's nice. And I have to set it aside, because in my own mind, it can actually derail me from thinking about what I need to think about. So I set aside the diagnosis, ask all my questions, and then come up with what we call a diagnostic pattern. So, it'll be something, that sounds, crazy to, to other people, but we might say, well, you have liver qi stagnation, you have kidney qi deficiency, you have damp heat in the lower jiao. But, we have to use that as the basis for the treatment, because that fits the paradigm of the medicine that we're using. So, there's not a one-to-one correlation between, the complaint somebody comes in with and the treatment, so sometimes people are like, well, do you have any herbs that can help me with sleep? And I say, yes, but there's probably there's thousands of herbs and hundreds of formulas. And
that's like, can I have a tire for my car?
Yeah.
Sure. Give me the wrong one, you're in trouble.
Right? No tires, you need street racer tires. I mean, what are your goals, right?
Yeah.
What kind of car are you driving? So, yeah, I mean, it's very similar to that, because, I can't just give a formula for, said disease, and it's not like we treat a lot of complex, we call them really knotty diseases. Somebody has fibromyalgia. This is a very multifactorial issue. You can't just say, the treatment for fibromyalgia is this.
Right.
You really got to look at the whole thing. I mean, we can say that there's commonalities. We can say, 80% of the time, it looks like this, or 60% of the time, or different things like that. And this is actually something that a lot of us are now studying. It's really important to understand the demographics of the people that we're mostly treating, because then you'll find a lot of the commonalities. So the people in a particular geographic area, going to the same places, drinking the same water, eating similar foods, and then you have to translate these Chinese methodologies that may have been written for people in a similar demographic, or maybe not. So at different times in Chinese history, the country has been, everything's going great, it's peaceful, the country's thriving, everybody's comfortable, or it's pretty poor, there's a lot of tribal wars, and the people in the countryside are starving. So you can't use the same treatments for a poor farmer in the countryside who's barely getting by from 1,000 years ago with somebody from a couple hundred years later at a time of peace when meat was plentiful and the country was really rich. And so they had different ways of looking at disease based on that. So
that's what I try to explain to my people, because they come to me with, and I tell them all the time, physical expressions of mental, emotional, and internal dis-ease. So I'm helping their body calm down on the outside and inside. But especially when I know I'm helping someone, if it's just functional, like you said, that's my specialty, that's where I shine. But when I've been working with them for a few weeks and I'm not seeing progress, and of course over time they start to tell me more information, I can start to see that I need to refer out because I think it may be connected to this system.
mm-hmm.
And to help people listening understand maybe in a practical sense what you're saying, what I tell everybody is that everybody's a snowflake. Just like there is no one else like you in any other capacity, how you got your sickness, injury, whatever, is different than the other person. So one patient that has fibromyalgia may have a concoction of events and family history and, toxins. Like my family were coal miners. I think that probably factors into some stuff that we have over generations. Some other people may have been misdiagnosed and had received wrong treatment for years and years and had a really high Epstein-Barr virus count, So there's different ways you come out with maybe a similar expression, like you said, and that's where typical standard medical care has a problem, because a lot of it is just timing. They don't sit down with people and ask all these questions. So when someone is in that paradigm of searching, and I've tried this treatment and this treatment and this practitioner, and I'm still not getting better, that's what pushes them towards people like you, is we've got to figure you out. I'm sure you hear this story every week in your clinic.
Yeah, and this is really an interesting thing. Like Chinese medicine is very much, nowadays they use the expression N of one, right? This is an N of one treatment, right? You hear that, I think, in the functional medicine realm.
Yeah.
And, it's like, well, that's cool. Chinese medicine, we were doing that for, the past couple thousand years, but
right. Kind of figured it out a long time ago.
But it's good. It's good that things are going in that direction, understanding, all these individual factors. And, going back to kind of some of the differences, again, like in China, in Western medicine, they'll want to do a double-blind study, and give everyone exactly the same treatment who have a certain issue, and come out and say, all right, it worked, this much better than a placebo, so, okay, we can approve it, but there's all these other differentiating factors, like you said, we need to figure out you. And the way that I would, do it is we would figure out your particular, Chinese medical patterns that we would then treat. So we have a saying that I often talk about this to my patients on the intake. We have a saying that says, same disease, different treatment, different disease, same treatment. So, I just said this the other day, somebody came in, I said, 3 people could come in and complain of more or less the same stuff, and I'm going to treat them in different ways based on, what we talk about and what the details are of what's going on. Or, 3 people could come in with very different symptoms, but I end up giving them very similar treatments because the underlying physiological imbalances, from my perspective, are very similar.
I think a good, mental picture is that meme that goes around of like entrepreneurship or the hustle or whatever, the the iceberg in the ocean, like just the peak is above the water, but then it's the down below that no one sees. That's
Mm-hmm.
like our health. A
Mm-hmm.
symptom is just a communication. A
Yeah.
diagnosis is just an observation. It tells you nothing about what that iceberg is below, which is what your specialty is figuring that out.
Yeah. Yeah. And this is an interesting thing with you talking about the diagnosis too. I mean, because sometimes a diagnosis, a person feels, aha, I finally know what's going on, you know, but then, like what we were just talking about, well, you don't exactly. I mean, you know some more of what's going on, and that's good.
Right.
Um, but it's not the whole story, for sure, for sure.
And I like to give examples because I want people to hear like, oh, that's me, or understand how this plays out in session, especially with me, because one of the stories that I like to tell, someone came to me with frozen shoulder. And
Mm-hmm.
when she came in, I was doing the intake, doing the movement, and she was, and she's almost in tears. She couldn't get her arm up. So she was diagnosed with frozen shoulder, and she was coming to me just to try to help a little bit. And I already knew from intake and just conversations, there was more to this story, but
Mm-hmm.
we have to be gentle with our clients and gradually get them to where they're willing to hear more information. But she kind of did it herself, because halfway through I'm doing a massage and, doing body work. She slides down and turns over. She has long hair, and she flipped her hair up and tied it in a bow and did like this, tucked her hair under. And I was like,
Did you
do you
realize you?
realize what you just did? She was like, what? I was like, you just had both hands above your head and it didn't hurt. She was like, oh. So I was like, you were told you had frozen shoulder, and then you started acting like you had frozen shoulder, which could give you frozen shoulder.
Mm-hmm.
So, but then like you said, another story, I did another podcast with someone that felt off her whole life and just didn't fit in and tried to make herself look and act like other girls, and just went for a long, long time, just really lost, and was diagnosed with autism at 30. And she was like, oh, now I can start to figure out how to help me be better, and regulate myself. So it's kind of a catch-22. Is sometimes it's great, like you said, but then sometimes it really makes the whole situation worse because it's not it at all. You must see that a lot.
Yeah, yeah, I see all kinds of things like that. So yeah, people come in and they have something, and they have it named, and it's a complex disease, and maybe they have some drugs, maybe they have a whole cocktail of drugs, and they feel, so a lot of times you just, well, is what's we're doing working, that's the big thing, and
That's
it's
a
work.
big, big question. And it's hard for people to break away from what's not working sometimes.
Yeah, yeah, especially if the treatment itself like came from somebody in a position of an authority, right? You come,
Hmm.
so doctor said I have this, and it's funny, you talk about frozen shoulder. I mean, I've had people come in, with frozen shoulder, and I'm treating them, and they say, well, I'm gonna, I had this appointment with my doctor. He scheduled it, quite a bit out. I had to schedule it 2 months in advance, right, just to get in, and they go and they come back and they're like, oh, my doctor told me I have frozen shoulder. And I was like, yeah, yeah, we know that. That's what we've been treating. But, like part of licensure, I mean, I can't make a Western
Right.
medical, right? As a Chinese medicine practitioner, I make a Chinese medical diagnosis, so I mean, it's not my place to tell them this is what you have necessarily. And, and it doesn't matter what you call it. I mean, I look at range of motion and I look at what's going on and,
Hmm.
things that I can do to help. But it was funny to me that just, oh, now I know what I have.
Yeah, I know. I see that all the time too. And I get x-rays brought in, or here, do you want to read this? I'm like, I'll see it and I'll find it and you'll tell me, as we go through the treatment. But so tell us how it would start to work and play out if someone does come in with hip pain, but through your process and treatment, you start to unwind the body and regulate systems that relieve the hip pain.
Mm-hmm. Yeah. So, a lot of times, I mean, if you're going to start, delving into something that's sort of other than the main complaint. I mean, obviously you kind of have to have a conversation with the person and be like, look, this is what I see, and then you got to start obviously asking not just the questions to find out, but then the questions to see if the person is up for, the treatment that you're proposing. I mean, you kind of have to get buy-in, that like, and get them to see, how these other things have contributed, and to say, well, I can't just, stick needles in your hip.
Mm-hmm.
We have to start.
Thank you. I'm glad you say that, because it does happen.
Yeah. Well, even, I mean, it's a little bit easier, I think sometimes, because even from the get-go, even if all I'm treating is like I say, you call it a musculoskeletal issue, and it really is, let's say, just a hip, muscles and whatever, I wouldn't necessarily put needles directly where the problem is, right? I might use their shoulder to treat the hip, or use their ankle to treat the hip, or the wrist, or some other part of the body. So, start right from the beginning. I'm already doing things away from, the area of complaint.
Mm-hmm.
So, but, if you can kind of get somebody to realize that the other factors are contributing to their main complaint, then, because then you have to start doing, maybe that it ends up being, a longer course of treatment, because you have to try to unwind a complex, chronic disease that, they weren't really even thinking anything could be done with. They just wanted their hip to feel better. They were thinking, well, I just have to live with this.
Mm-hmm.
But can you make my hip feel better? I was like, well, you got to make them think, well, no, we really can make some progress, but it requires a greater commitment.
Right.
And greater changes. So that it can be challenging. Like you said, sometimes people aren't willing to make that shift. Sometimes they're all for it. As soon as they realize that something can be done, they'll jump in. So it just depends on the person.
Another big point that I try to push home is you have to be a willing participant in your wellness journey, or it just doesn't work.
Mm-hmm.
We're not machines. We can't just take an arm off and put a new one on and be good to go.
Yeah.
Again, how that arm got hurt, it might have been emotional abuse that caused you to have a certain posture your whole life. So that's what we do, is ask questions to figure out how and why. So when you're treating, what are meridians? How do they help you navigate that blueprint that was written on a person's body, that an ankle could help a hip?
Sure. So meridians are, I mean, I like to call them channels, but in a lot of ways, it's a map of the body in one sense. So if I'm on, there's sort of, they're all longitudinal on the body, and so if I'm near, a certain area of a meridian, then I know, kind of where I am on the body, and all the points are numbered and that, so I can kind of map out the body. And so, like, if I want to use different parts of the body to treat, another part. So yeah, except I'm using the shoulder to treat the hip, then, there's all these different interrelationships of how the meridians are related to each other and balance each other. But essentially, they're also, when I often tell my clients is, if you look at these meridians on the chart, or I have a little statue in the office, and I point to him, I call my educational assistant, it's my little statue. His name is Larry. And you look at the lines on Larry's body, this tells you basically how one area of the body is connected to another. And so, some of the channels go from head to toe, some from the arm to the torso. And so most people, once, they see this is just the areas of connection. So when we stimulate something here, we can create an effect over there. And most people understand that. I think if they were really close to that idea, they wouldn't be in my office to begin with.
Mm-hmm.
But they are, so usually that's enough, to kind of get that idea started. And then, a little bit deeper of like, what is a meridian? The way I think of it is, aside from everything I just said, but another way is it's a neurovascular, now I want to say junction. What's the word I'm looking for? It's the neurovascular system, basically. So the meridians follow the nervous system. Mm-hmm. So, it's not like it's an invisible field or anything like that. This is something that's, it's both sort of metaphorical and physical.
Right. Kind of like you can't put your finger on love, but you can sure feel it.
Yeah, well, in a sense you can put, because when I needle, a certain point, I know that I'm affecting, the nervous system. I know oftentimes, what nerve I'm affecting.
Mm-hmm.
So if I want to treat somebody, so I actually specialize in a lot of neurological issues, concussion recovery, stroke recovery, things like that. And so, I know, that we're hitting certain nerves or stimulating them, regulating them. And, so we kind of know what's going on, and that we're able to now start to peel out, because we have these ancient books that tell us this certain point, has these effects. And so now, because of the nervous system and the way it plays out in the body, we can start to explain, oh, that's why when we needle here, we can regulate different areas. So
Concussion recovery and care is a huge one that I see mistreated and untreated so often.
Mm-hmm.
So what can you tell us some stories or, cases that you've experienced in the past that you've helped people find recovery? Because I've had a couple of clients that years after their concussion, they still have trouble with certain noises and light, obviously. What is it that you're able to do with someone that's had, an impact, but through your therapeutic treatment are able to help regulate that?
Sure. Well, so what we start with, if somebody has that history, or a lot of times they don't even tell me. It's not necessarily why they came in. They have complaints, and it's become my habit now just to ask, about any impacts that they may have had. So what it starts with an assessment. So this is a great example of a combination of, kind of Western and Eastern ideas. So, I do a functional neurologic assessment. If somebody has that issue, or I, decide that, I think we should do this, that, and it takes a fair amount of time doing a lot of different things to see which areas of the brain are under functioning, and then that really helps to guide the treatment. So then it might follow with scalp acupuncture. It might follow with body acupuncture with points that we know, kind of affect that area. We have kind of a whole treatment protocol we call a neural flush technique that my friend has developed and showed me, and that just really stimulates blood flow to the brain. And I've had a lot of people, they get off the treatment and they're like, the whole room is brighter.
Yeah.
And that lasts for, a significant amount of time, sometimes, really long time. And so we can make, really help. But it just all starts with the assessment again, and figuring out which areas of the brain need support.
And it's so interesting, as a palpation therapist, which I am, I have my hands on these people, and I can give you personal, recognition of what you're saying, because I can feel in people. It's like their scalp is, a brick wall. There's no blood flow. There's no health. It's just like the bone and a little bit of skin on top. So that's when people wonder why I get so passionate about these things, is when I'm feeling something, I know what healthy tissue and healthy muscle and healthy body feels like. And I know when I have my hands on something, like, this is not okay. We need to start looking into this. And with craniosacral therapy, I can't tell you how many times I've been doing craniosacral work, and I feel tears running down, and they hit my fingers. So I know in that moment, there's something connecting back in the body and the brain in that moment. So let's talk a little bit about that psycho-emotional component, wreaking havoc in the systems, presenting in pain, and then where you come into that.
Sure. So yeah, I mean, a similar experience I have, I tell my clients that, hey, you may have some emotional stuff come up, and so I'll have people get off their, I mostly treat in recliners, so they get off their chair and they'll be like, I started crying and I'm not sure why. It felt good though.
Yeah.
And, it's like, great, great. That was wonderful. So yeah, definitely. And I think in Chinese medicine too, we have an understanding of how, um, they looked at it, I think, in terms of emotions that weren't properly in harmony. So all of the organ systems and their associated meridians have associations with different emotional states. So a lot of times, the liver is famous for kind of being the angry, organ that regulates that, or the lung is often associated with grief and sadness or loss, things like that. So when we know, if there's been a trauma, then we can kind of see what areas may be affected. Sometimes, again, people don't bring them up sometimes, but when you start to treat the associated channels and the organs, then sometimes these things, yeah, they just open up and it comes out, and people remember. So you do this. I mean, sometimes it comes out the eyes, but sometimes it comes out. They're like, oh, I remember this time this and so happened, and sometimes when people cry like that, they're like, yeah, I was thinking of my dad. I don't know why, but
Because the nervous system never forgets.
hmm
People
yeah,
think, well, I had an injury when I was a kid, but that couldn't be it.
right, right. Just like scars. It's like 20 years old. I can't possibly be doing anything, right?
Yeah. What about a big part of my work is with moms
Mm-hmm.
that have had C-sections, and they go for years and years and years and tons of different treatments for low back pain.
Mm-hmm.
And no one's ever talked about their C-section scar. And maybe even they got sick in the hospital, had a traumatic delivery, and they disassociate with that part of the body. Any experience working with our mamas and helping them get well?
Yeah, so I mean, Chinese medicine has a lot of resources, kind of on both sides of that. I mean, helping people get pregnant in the first place. There's a long tradition of postpartum care. My ex-wife was a really, really passionate about Chinese medicine as far as postpartum. And so there's a lot of health building activities and things that they do for that. And then, yeah, so with the scars, I mean, definitely. I mean, it's not that completely unlike the things that you've learned. Some of the treatment modalities may be a little different, but the idea, so if you think strictly in terms of Chinese medicine, we might say, oh, this scar cut this way, all the meridians run this way, so you've essentially cut a meridian, right? You've cut off, but again, you've kind of cut off circulation, of nerve flow, and like you said, it could be a trauma component to it. So all of those things can play in, and again, assessment, right? You figure out what's going on. I do a fair amount of the manual muscle testing, that I think you probably do as well. Some of the things that we've probably taken in common, and so understanding kind of the muscular system, and you figure out what's not working, and I may apply a different treatment than some of the than you and some of the other people, but the whole idea is from a functional perspective.
Right.
How's
I tell all my people, and people communicate with me from out of state on social media and stuff, and they should I try this? And I'm like, yep, try all the things. Unless I can tell you it's absolutely contraindicated for you, then yes, try it. Because you don't know what treatment may help you, and it may not help another person, but you don't know until you try.
yeah.
Another big topic, especially here in Charlotte, and I'm sure everywhere, is Botox.
Okay.
Big deal. So TMJ, clenching, jaw,
Mm-hmm.
headaches.
Mm-hmm.
We want to tell everyone that your type of care doesn't add toxins to your body.
That's right.
Trying to put it very sweetly, but what would that look like? You're helping someone with TMJD or headaches.
Mm-hmm. Yeah, so I treat a lot of people with migraines, and it's pretty fabulously effective. So sometimes, maybe they've already been getting treatment for a while, so they've had Botox in the past, or it's a lot of times when people start to have an issue, they'll go to me, they'll go to their doctor, they'll go to a lot of different places at once. And so sometimes they'll even after they've started treatment, the doctor will say, well, I have to get Botox. And actually I have a client for a lot of neurologic issues, and he, part of it is migraines too. And, especially if there's it was kind of a work related thing. And so there was some, claims that way. And so he's like, well, I have to do, what my doctor says. I can't tell him, I can't really refuse the treatment, or then then they're not going to pay for, everything. Right. So,
Yep.
but he's like, he was like, I don't really want to go, and you're helping me more than any of these people ever have. So, but yeah, I mean, I think Chinese medicine is a great alternative to that. And we treat migraines, TMJ all the time. It works really well.
I think you brought up a good point for people to understand, because a lot of this is very new to them, and they literally can't, they're so severely in pain, they can't work, and they go and do this thing. And I tell them, don't feel bad that you've done that thing, that said treatment or whatever. And if that's your choice, like in this circumstance, if that's part of your healthcare routine you're taking at the moment, let's also do this and this and this. And while that actual treatment may have severe side effects, let's bolster the system to where it can better handle the onslaught of said technique that might be harmful in some capacities.
Yeah, that's a good point too. Is you don't necessarily, I don't necessarily want to discourage people from doing certain treatments, right? I mean, if they're like, well, if that's, I mean, I sort of maybe say some experience and, say, well, this is what I would do. And then they can kind of decide based on that information. So yeah, but definitely working alongside and saying, all right, this treatment, yeah, there are some benefits, but you're having other side effects. And so, trying to work with people also to help them with the side effects of other treatments, can be really big, really helpful.
And I think a takeaway there is, like you said in the beginning, if it's not working, how much time are you willing to lose? And that's one of the biggest things that I see with people is losing time is more important than trying the wrong thing for a little bit. So if you stay in the pattern of the same care or routine or protocol that's just not working, your systems have become even more deficient during that time. And now you have more problems to work with. So I think your point is just, when what I try to tell people too is, let's just get all the systems as functional as possible so that it helps whatever the symptom expression is.
Yeah, no, that's a great point. If, is really what we want is function. And, we trust the body's regulating mechanisms, right? So if you just kind of take things out of the way and help the body re-regulate, like it'll be able to find a lot of the balance that it needs.
So anxiety, depression, those paradigms, do people come to you for that specifically, or they come to you with something else and, oh, by the way, I have this as well, and then you're like, I got that too?
Yeah, both circumstances. So sometimes it's the specific main complaint, and sometimes it's a something that and again, it may be something that they don't even think could be treated. It may be, they may feel they may be on an SSRI or some other medication. They feel it's controlled, and if that's the case, then I just fine. I certainly don't convince somebody to stop their medications or anything like that. If sometimes people though come to me with the stated goal as, I want to get off these medications and I want to find something alternative to to still give me a good effect, so they can still get treatment. So if that's the case, then we'll go back to your prescribing physician and see if you can wean off and figure out that process, and then we'll do our best to to try to help you find the healing you need in another way. So
again, trying to get people to understand, you don't have to choose him or your doctor. It's okay for them both to work together. I will say, however, if you bring up working with an alternative practitioner and you get scorned or shamed from your attending physician, find a new one, because there's a lot of great ones out there that totally subscribe to your type of care, but they just know that what they're specialized in, they're really good at it. So there are definitely Western medical doctors that are amazing at what they do and love working with other practitioners because they see their people getting better. So I hear this with OBGYNs all the time. And I've been treated by some that were just horrible, had no bedside manner, wanted to do a surgery when I was 25. And I was like, that just doesn't sound right. So listen to your gut feeling, especially when you're in a time of pain or unknowing of a diagnosis. It's not the time to go with that first answer for sure. So Western, holistic, whatever, if you're getting, like I said, shamed or your ideas or feelings are dismissed, it's time to look for another practitioner. I'm sure you've heard those stories and you've gotten some clients from that storyline as well.
Yeah, I feel in my practice, I've been in practice about 10 years, and I feel just in the time I've been doing it, the balance is shifting. And I see that less and less, and I see people come in more and more, saying that maybe their doctor said, why don't you try acupuncture? For some of the neurologic issues, for migraines, for gynecological issues. Definitely seeing more and more people coming in because a doctor actually recommended that they try it. So
Beautiful.
that's, yeah, it's really exciting. And it's, there's still a few people that are like, they told their doctor, that they were doing acupuncture, and, a lot of times they might just say, okay. And, like, well, it's really helping me. It's like, all right, well, keep doing it then. Sometimes people are like, wow, really great. Who do you go to? Bring me his card, because they want someone to refer to.
Yes.
But sometimes somebody said, yeah, I saw him right in my chart that I was doing acupuncture, and, they didn't bring it up anything other than that. So, you get the whole range of responses, I think.
Mm-hmm.
But more and more, I think people are open to it. And I think it's important, for practitioners like myself to be able to, talk to our clients in a way that they understand. So, when I talk to a client, I don't tell them, well, you've got liver chi stagnation. I try to explain things in a way that makes sense to them.
Mm-hmm.
So it's, there's all that stress is affecting your systems, and, what this is going to do is, help to regulate your autonomic nervous system and bring you a little bit more parasympathetic. We're going to downregulate your sympathetic, and, basically just help you be calm. Does that sound good? It's like, yeah, that sounds great. So,
The better we learn how to manage our bodies, the better they will be. And that's another thing that's just missed in some care, because there's just so many people they have to get to in a day. And that's working one-on-one with a practitioner like you is so different. So we talked a little bit about the acupuncture side. And I also want to make this point as well. Like I said, there's bad lawyers, good lawyers, bad massage therapists, good massage therapists. In holistic care, you can have some practitioners that give you a bag full of 20 bottles of herbs to take too. So it goes back to, you finding out exactly what it is they need and why. So when you talk about herbal medicine, what is it that you're using? How is it helping?
Yeah, so it's a great point about having a big bag. I remember when I was in school and I was still working, one of the guys that I worked with went to a very famous doctor, in downtown in the city, and he came away with a huge bag of stuff that cost a lot of money, and he felt kind of weird about it, he kind of got. It's a good doctor, and I don't necessarily doubt his abilities, but he also, had a business model, I think, that relied on a lot of herb sales. And, so I think it's important, for me, it's important to pinpoint, probably just a couple things that people need.
Mm-hmm.
I don't, we do kind of stack different formulas sometimes, but I don't want to send somebody out with a huge, bag and where they're taking tons of pills. A lot of the companies that I use, or some of the companies, we have different forms. It's not just pills. They can make it into teas. There's different granules and powders, and so they can drink it. And so usually we can keep things down to a reasonable amount of what they can take. Because you give somebody 20 things to take, and they're really going to do it. Compliance is super. No treatment's going to help if people don't actually take it.
Right.
Right. I try to find the companies where, I really know and trust the quality of what they're bringing. that can be obviously a little bit more expensive sometimes, if rather than somebody is like, well, I can get the same thing in Chinatown for a lot less. And I was like, well, you can do that if you want.
Yeah.
Work. It might be, some stuff might be adulterated with, some pharmaceuticals that aren't on the label. So definitely everything is tested and, tested for both the so what they say is in it is actually in it, and that there's nothing else extra. So that's really important. And a lot of my suppliers practice really good. So we're harvesting plants, right? So you can't just go in and like clear cut all of a particular plant, right? Because then you can't come back next year and get any more.
Right.
So they sustainably harvest. Some of my suppliers use some of the traditional growing methods, and also support their kind of the local communities where they're harvesting from. So it creates jobs in rural communities, in China where they're getting a lot of these herbs from. So, and then, they go through a lot of testing before they actually end up in a product. So
I think
yeah.
that's one of the invaluable points to push home with people, because in Charlotte, there's several naturopathic doctors and functional medicine doctors. And that's what I try to get people to understand. First of all, stop self-diagnosing off of Dr. Google, and stop ordering your stuff off Amazon, because you have no idea what is in it, number one, how it was created, number two, and the capsule that it's put into, by the way, doesn't have to be tested at the end product result. So you have no idea what that dye is, what that coating is. Practitioners like yourself, that's one of the other invaluable things you bring to the table, is you do the research on these products. So if you're asking someone to take something, it's good for them.
Mm-hmm.
And another thing is, just like with me, if someone comes to me in pain, I don't ever want them to think, I need you to come to me every other week for 6 months to get better. And I think you would agree. I don't want you to have to take this thing for the rest of your life, because that means
Right.
your systems aren't getting better. So that's another telltale sign when people are out there and trying to find a practitioner to help them, to start listening to what's going on. Are they wanting you to be, taking this thing for forever? Or are they trying to help your body get better?
Yeah, it's a great point. And like in a Chinese medicine perspective, we don't give someone the same formula the whole time, right? So we take people through stages of treatment. And so with a really even a complex disease that may take a long time to really make progress, something like rheumatoid arthritis or fibromyalgia, it takes some time to really get someone to the end point that they're really looking for. But it's not just that they're taking the same thing the whole time, right? So we're getting, like you said, getting the systems, so we take people through a framework, if it's a really complex disease, where we're regulating the immune system, and then the digestive system, and the nervous system, and the circulatory system. So, and the treatments are changing through that process. So it's really important to kind of get through that process. And like you
And
said,
you have eyes on the client, and you're
yeah,
constantly monitoring, okay, how is your body responding to this? How do I
yep,
need to tweak it? How do I need to change?
exactly. Yeah, it's not I like to say it's not a protocol, it's a treatment framework,
Yeah.
Flexible. So
What about children? Do you help children in your practice?
in my practice, I don't see a lot of children. I see a few, mostly, ages in, double digits at least,
Mm-hmm.
but not a lot. There are some of my colleagues who specialize in that. Children tend to respond pretty quickly, so it's definitely something that's a great option. And there are a lot of herbal products. There's different lines that are specifically made, in dosages and things tolerable for children, made just for children and their issues, some of the things they have. So it's definitely something that, that people could seek out.
I would correlate that to craniosacral work. Like, I don't work with children with craniosacral therapy. It's just, I've not been trained that way. I haven't made that shift into that direction, but I have a practitioner that I refer to. That's all she does. And it's
Mm-hmm.
amazing, because they have a lot of cranial issues from birth. And
Yeah.
a lot of children have a lot of issues from the birth process as well. So just another encouragement to people, seek out those practitioners that specialize in pediatric alternative care, because it's available. And I hear a lot of little ones with a lot of tummy issues. So I know that you guys will be able to help. And then last question, what would you want to leave the listeners with of, myths you've heard that people think about Chinese medicine, or just incorrect assumptions that you've heard people say that you'd like to set people straight on, so that they also feel empowered and encouraged to seek out alternative care?
Sure. I think, just getting back to kind of what we talked about in the beginning is demystifying it a little bit. Just the idea that this is not a mystical spiritual system. This is a practical physical medicine. And it's rooted in a little bit of a different culture, a very different culture. But, the people were observing the human body and trying to figure out what was going on, and, developed a system of medicine that, if you understand the paradigm and you find a practitioner who sticks to the paradigm, is really, really highly effective. And it's great at, like we talked about, figuring out the individual case person in front of them, and how best to tweak things in order to help them. So I just think it, the mystification of it, we have a tendency, who is from the East, and like everyone walking around in China is like, all super spiritual and everything like that. They're not. They're actually, when I lived there, they're very practical people, and if things, they smell out BS pretty quick sometimes. So I think they Chinese medicine is not a new age thing. It's an old age thing, but it's something that's very practical, very physical, and very much based on understanding how our bodies work from a systems perspective, and it can help a lot of different things. Especially, I think the best strength is some of the chronic issues. When I was in a networking group, I went in one day and I had said, sometimes we'd say, who do you know who has this, right? And so I was like, who do you know who, has an issue that hasn't been explained? I've had people say doctors can't explain their pain. They can't explain, why their stomach's like this. The tests all came back normal. That's a great candidate for somebody to look at Chinese medicine, because then we can delve deeper, or from a different perspective, you could say, and try to figure out what's going on with that person and help them a lot.
I think that's a great way to leave it, is you're diving deeper. That's the whole goal. So thank you so much for spending this time with me. I hope that if you have listened, then you are encouraged and feel empowered to seek out alternative care, in addition to, or if you're doing nothing like most men, seek care that looks at who you are as an individual. That's the whole goal of this podcast, of this episode, of showcasing these other types of therapy and treatment that you can get out there and find answers and get your systems better. So thank you so much, Michael. I appreciate you talking with me tonight. And I'll leave all your information in the show notes. If people want to contact you, they'll be able to do that. Thank you so much. Have a great night.